Hey, Mr. Sulo.
Hello.
How are you today?
Good.
Good. My name is Brian. I'm a registered nurse here at Roseman University of Health Sciences. I'm going to be doing your history taking today.
Okay.
Excellent. If you mind, please have a seat for me here.
Thank you.
And how may I address you, Mr. Willigans or Mr. Sulo?
Either way.
Either way? Okay. We'll stay with Mr. Sulo. So can you start out by telling me your full name and date of birth?
Olivier Sulo, May 2nd, 1980.
I'm just going to be entering some information here as I go through this. And the purpose of our meeting today is I'm going to be asking you a few questions about what brought you here today, giving some information for the healthcare provider to diagnose and prescribe treatment for you. Okay. I have provided for sufficient lighting. I have reduced any distracting noises or objects from the area. I have provided for privacy, and I've ensured that there will be no interruptions during the interview. May I call you Mr. Sulo?
Yes.
Excellent, Mr. Sulo. The purpose of our meeting here today is I'm going to be giving some history, some information from you about what brought you here today. As I ask you some questions, you're going to see me turn here. I'm going to do some typing. I'm just entering data into the medical record for the physician to provide care to you. So can we start out by, if you please tell me your full name.
Olivier Sulo.
And Mr. Sulo, what is your date of birth?
May 2nd, 1980.
So that makes you 34?
Yes.
34 years old. Okay. And how would you identify gender, male or female?
Female. Male.
Male. And how would you identify your race or ethnicity?
White.
Great. All right. So tell me, what brought you here today?
I came because my chest had been hurt.
Just Can you please point to the exact location where you feel?
You see, it hurts right here in the middle.
Right there in the middle. Okay. Can you tell me, does the pain radiate anywhere?
No, it's a crushing sensation like somebody's sitting on my chest.
Okay, so you describe it as a crushing sensation?
Yes.
Okay. Somebody's sitting on your chest. On a scale of 0 to 10, 0 being no pain and 10 being the worst, how would you rate the pain?
It doesn't really hurt right now. When it hurts the most, I would say 5 out of 10.
Okay, so currently it's a 0,
Currently it's
but
a 0.
at the worst it's 5 out of 10.
Yes.
Can you tell me about the onset? How often is this happening?
It comes and goes. It's not constant. It started happening about a month ago. It lasts anywhere from 5 to 30 minutes.
Okay, so it's intermittent. First noticed it about a month ago, you said?
Yes.
Okay. Excuse me, it lasts
5 to 30 minutes.
5 to 30 minutes, okay. When you experience the pain, can you tell me, are you doing anything in particular?
I first felt it at home when I was mowing the lawn.
Okay, when you were mowing the lawn. Any other times when you've, since that first time, has there been any other different activities that you've been doing or different times when it's been occurring?
Sitting down under the shade makes it feel better. Already made it feel better for the first time. Other times I had to go inside and lay in bed for a while. If I didn't stop what I was doing, that seemed to make it worse. Also, if I had a cigarette at the time, that really seemed to make it hurt.
Okay. Smoking or continuing the activity
Yes.
makes it worse.
Yes.
And either stopping what you're doing or relaxing and laying down makes it better.
Yes.
Okay. Are there any other symptoms that you're experiencing? Either during that time or even outside of that? Anything else going on?
I can't catch my breath.
Can you tell me, how is this impacting your daily living, the activities that you like to do?
Well, I'm worried it's a heart attack. I really like to work in the backyard, and this pain makes it hard.
Okay. Mr. Sula, how would you describe your overall health?
I don't have any other problems, although I do smoke, and they tell me that it's bad for you.
Okay. Do you have any allergies?
Penicillin.
Penicillin. Okay. Any other allergies to things like latex or tapes?
No.
Or seasonal allergies, anything like that?
No. The penicillin gives me a rash.
Oh, thank you. That was going to be my next question. But so the reaction to the penicillin gives you a rash?
Yes.
Are you currently taking any medications?
Vitamins
Vitamins.
for my muscles.
Okay, so I think that about is all the information I need. So basically, just to kind of summarize, you're here today for a chest pain.
Yes.
It's located right here in the middle of your chest.
Yes.
It doesn't radiate anywhere.
No.
You described it as a crushing pain, as though somebody's on your chest.
Yes.
Currently, you're not experiencing, but at its worst, it's about a 5 out of 10.
Yes.
You find that it happens most often when you're doing some sort of physical activity,
Yes.
and it's alleviated by resting or stopping that activity. But it does get worse when you smoke.
Yes, it does.
Okay. And you're worried that it might be a heart attack?
I think so.
I will make sure that the physician will look at this information, and they'll be in here to talk to you and get you taken care of. Do you have any questions for me at all?
No.
Okay. I think that's about wraps up our interview. Thank you very much. I appreciate your
Thank you.
cooperation.
Thank you.